What can I expect with secondary bone cancer progression? Secondary bone cancer, also called bone metastasis, happens when cancer cells from another part of the body spread to the bones. It's much more common than primary bone cancer, which starts in the bone itself. Knowing what to expect as the disease advances can help patients and families prepare for the physical, emotional, and practical changes ahead. Secondary bone cancer begins when cancer cells from tumors in organs like the breast, prostate, lung, or thyroid travel through the blood or lymphatic system and settle in the bones. The bones most often affected are the spine, ribs, pelvis, and the long bones in the arms and legs. How the disease progresses depends on where the cancer has spread, how much of the bone is involved, and the type of primary cancer. The most common symptom is bone pain. This pain tends to be a dull, persistent ache that may get worse at night or with movement. For example, if the cancer is in the spine, it might cause back pain that radiates to the arms or legs. If it's in the leg bones, pain may come when walking or moving. If you notice pain lasting more than 2 weeks, especially if it wakes you up or worsens with activity, it's important to see a healthcare provider for evaluation. As the cancer progresses, the bones can weaken, leading to fractures even without a fall or injury. These are called pathological fractures. The spine is a common site for such fractures, and they can cause serious problems like spinal cord compression. Symptoms of spinal cord compression include numbness, tingling, weakness in the limbs, difficulty walking, and sometimes loss of bladder or bowel control. This is a medical emergency requiring immediate attention. Another complication is hypercalcemia, which occurs when the breakdown of bone releases too much calcium into the blood. Symptoms include nausea, vomiting, constipation, increased thirst, confusion, and fatigue. Hypercalcemia needs prompt treatment to prevent serious health issues. Secondary bone cancer can also affect the bone marrow, where blood cells are made. This can cause anemia, leading to fatigue and weakness, low white blood cell counts, increasing infection risk, and low platelets, which can cause easy bruising or bleeding. Patients might feel unusually tired, short of breath, or notice they get sick more often. Diagnosis often involves imaging tests like X-rays, CT scans, MRI, or bone scans. Sometimes a biopsy is needed to confirm the cancer's origin. Monitoring the disease regularly helps manage symptoms and adjust treatments as needed. Blood tests can detect complications like high calcium levels or changes in blood cell counts. Treatment focuses on relieving symptoms, slowing disease progression, and maintaining quality of life. Medications can help manage pain and strengthen bones. Radiation therapy can target specific areas of bone involvement. Chemotherapy or hormone therapy may be used to treat the primary cancer. Surgery might be necessary to stabilize bones or relieving pressure on the spinal cord. Pain management is a key part of care, with various medications and supportive therapies available. Physical therapy and mobility aids can help maintain independence and reduce full risk. The outlook varies widely depending on the primary cancer, how much the bones are involved, and how well the disease responds to treatment. While secondary bone cancer is generally not curable, many people live 4 months or even years with proper care and symptom management. Focusing on quality of life is essential. Emotional support through counseling, support groups, or palliative care can help cope with the emotional impact. Patients and caregivers should keep open communication with healthcare teams, report new or worsening symptoms promptly, and plan ahead for care preferences. Remember, each person's experience is unique, and treatment plans are tailored to individual needs. Always consult your healthcare provider for personalized advice. This overview aims to provide helpful, accurate information to better understand what to expect as secondary bone cancer progresses.